Well, hey everybody, this is Robert, and welcome to this Outbreak Newscast. News out of India. Officials in Kerala state in southern India are reporting a fatal case of Nipah virus infection in a 14-year-old boy from Mallapuram district in the state. The National Ministry of Health and Family Welfare reports the boy exhibited acute encephalitis syndrome symptoms and was admitted to a healthcare facility in Perinthalmanna before being transferred to a higher health center in Kozhikode. However, the patient later succumbed to the disease. The samples were sent to the National Institute of Virology in Pune, which had confirmed the Nipah virus infection. Health authorities have advised the following immediate public health measures to be taken by the state government. 1. Active case search in the family of the confirmed case, the neighborhood, and areas with similar topography. 2. Active contact tracing for any contacts during the past 12 days. 3. Strict quarantine of the contacts of the case and isolation of any suspects. And lastly, collection and transportation of samples for lab testing. A multi-member joint outbreak response team from the National One Health Mission of the Union Health Ministry will be deployed to support the state in investigating the case, identifying epidemiological linkages, and providing technical assistance. Now, additionally, at the state's request, ICMR has sent monoclonal antibodies for patient management and a mobile BSL-3 laboratory for testing additional samples from contacts that have arrived from Kozhikode. The monoclonal antibodies had reached before the patient died but could not be used due to his poor general condition. Now, Kerala State is no stranger to Nipah virus, and it has reported several outbreaks in recent years. Kozhikode and Mallapuram, Kerala in 2018, which saw a total of 23 cases confirmed and probable, with a 91% case fatality rate. In Ernakulam in Kerala State in 2019, there was a single case which survived. In Kozhikode, Kerala in 2021, there was one fatal case. And last year, there were 6 cases and 2 fatalities in Kozhikode District, Kerala, that occurred during September 2023. Now, this is the first known case in India that I'm aware of this year. Bangladesh has reported 4 fatal cases earlier in the year. Now, Nipah virus is an emerging and serious viral zoonotic disease that carries with it a high case fatality rate right around the ballpark of 70% or more. Nipah virus is an enveloped RNA virus, along with Hendra make up the Nipah viruses. The natural host of the virus are fruit bats of the Pteropodia family, Pteropus genus. It was first recognized in a large outbreak in Kampung Sungai Nipah, Malaysia, and Singapore from September 1998 to May 1999. In this outbreak, 276 cases were reported, and the vast majority, more than 90%, being pig farmers or people who had contact with pigs. The disease presented as encephalitis, and 4 out of 10 people died. It is theorized that the pigs got infected consuming partially bat-eaten fruit that ended up in the pigsty. Pigs were the intermediate host in this case. However, subsequent outbreaks had no intermediate host. Since 1999, there have been no new outbreaks reported in Malaysia. Now, the outbreaks reported since the initial one in Malaysia have all been in Bangladesh and India. And they have been linked to 2 possible routes of transmission: consumption of raw date palm sap that had been contaminated with urine or saliva from the infected fruit bats. And there's strong evidence that points to human transmission. In other words, close physical contact, especially with any kind of contact with body fluids. Thanks for listening.